So when we initially built our pandemic response lab, we did that fairly quickly and we were very successful with that. But the ideal would be to be more ready, be more prepared for the next pandemic. And we've learned a lot, and we don't want to lose that capacity. And so what we're doing and accomplishing with the help of donors and others is to pivot from our pandemic response to a response to endemic things that are always with us, germs that affect our community on a daily basis, and that we can do things differently to try to get ahead of those. And so by making the pivot, the equipment is a lot the same, or the techniques and technologies are. The germs are a little different, but we maintain readiness that we could start testing for a new germ, say bird flu or something else, pretty quickly because we've got all the processes and equipment we need to do that. We have basically two areas on this hallway. One area is the Louisiana Strategic Research Laboratory. That is our reference laboratory for clinical grade testing, much like would be done at a pathology lab or even in a hospital. Then the remainder of labs that we've renovated are for research purposes in the same vein, in infectious diseases, microbiology, understanding microbiome, detecting pathogens like sexually transmitted infections in wastewater, sequencing of those pathogens to understand their different components. Not only does it maintain that preparedness, but it allows us to do more for our community. It helps LSU fulfill its mission to the state, focusing on research as well as education and really a public health mission, and offers the ability to change the tide of some things that are really not positive for Louisiana. Being number one in chlamydia, number two in gonorrhea nationwide are not positive stats that we like. But we have to do something different to change that. And this is the different. This is going to make a change.